Tissue healing and repair. We're going to talk about the steps involved after a tissue is injured that goes through the stages of inflammation, organization, and regeneration. So right here, before we can actually get to inflammation, regeneration, and maturation, we end up having to go through and have the initial injury. So this right here is representing like a piece of glass or something that's actually stuck into the skin. Shows that we've gone through the epithelial layer, into the dermal layer, and down into the past the papillary layer, into the reticular layer where we have blood vessels. And we've introduced bacteria and had some type of damage to the skin there. So right after the injury occurs, we're going to get the first stages of inflammation and hemostasis. Some people actually put hemostasis as a separate stage. Here we're going to actually combine it, and in the book they just have inflammation, but I think it's important to also consider the fact that along with this injury you have to have that happens to the body, you're going to have bleeding, and you have to have some way to actually stop that bleeding, and that's hemostasis. And so this is an initial response to some type of injury, and the goal of the body with inflammation and hemostasis is to, first off, limit further damage. That's what we end up doing with hemostasis. Calm the immune system, get rid of harmful agents. This can be bacteria, this can be fungi, but this can also be things like dead cells and the toxic substances that would come out, different waste materials that would end up being toxic. And then it's actually trying to control, making sure that the blood's going to stay in the body and lay down a scaffolding. Happens in inflammation, the scaffolding, that healing is going to happen underneath the organization phase, which is also known as granulation or proliferation. And so this is where we actually get the fibroblast actually making collagen fibers to actually pull the wound back together to close it off. Also underneath proliferation is where we're going to call in a lot of the body's white blood cells to actually take care of the damage in that area and make sure that no infection can arise. It starts with inflammation, but it continues definitely throughout the proliferation stage. Also in proliferation, we get like growing of new blood vessels, which is known as angiogenesis, to this area too. Lastly, we have the regeneration or the maturation stage, and this is where we actually have changing of all of that scar tissue that's been built to reduce the size of the scar and to return the area back to its normal function and strength. So when we look at inflammation, we have, this is the very first step of the process. So first off, we get vasoconstriction. So when there's an injury in the area, the first thing the body's going to do is actually constrict all of the blood vessels right where the wound's at. It's kind of a trigger of the chemicals in the area. The body senses that there's bleeding, and so it's going to do the first thing is try to vasoconstrict the area. Later on, constriction turns into dilation, which is really down here at number 5. And the book kind of has it organized this way, but I really wish it was down here where you would say vasoconstriction and later on dilation, because histamine and heparin release is actually what gives us vasodilation later on. We get edema and swelling. This is from damage to the blood vessel. So as you can see right here, we have a blood vessel. We have the injury in there. Blood's going to come up through there. And at the same time, we're going to get leakage of plasma into the tissues, and with that it's actually going to help to pull in extra fluid there. And so actually edema has a role that it plays as far as making it easier for white blood cells to get in there and actually make it easier for some of the cells to move around, some of the fibroblasts to start healing. These things happen really fast after an injury, and along with this is clot formation. I know they have that as number 3. Clot formation is really we kind of haven't organized the way that it is, but clot formation really should be up here at number 1. As soon as we get an injury and it involves a blood vessel, clot formation is starting almost right away immediately with your platelets and the fibrinogen that's going to be formed for the clot. And that fibrinogen is going to be very important later on, because fibroblasts will use that as a scaffolding to actually start to crawl out on and then actually start to lay down granulation tissue. Then we get into phagocytosis. So this is getting the white blood cells. So the local neutrophils in the area are going to be activated immediately to start taking care of damaged cells to take care of bacteria, different things like that. And then lastly, mast cells will migrate into the area shortly afterwards. They're already in the tissues, but they will start to release histamine, which will actually call in more of the immune cells. So we'll start getting eosinophils, monocytes on top of all the neutrophils that will be coming. And then heparin. And heparin's important anticoagulant, so it kind of slows down the clotting formation of the blood of the clots. And then it actually allows for those white blood cells to move around in the tissue much more immediately, or much more easily. This starts immediately after the wound, and the inflammatory stage can last up to 6 days. It's usually only about 2 or 3 days on average for most wounds, but it can last up to 6 days. Something like an infection in a wound can actually make it last much beyond the 6 days, but on average, we say it lasts up to 6 days. Next is organization. It can be known as proliferation, which is, I have it in notes here. Some books might also call it granulation, because it's the formation of granulation tissue, but this is when we start having the fibroblasts start to create collagen fibers to actually take and start closing this wound in. And phagocytosis continues with this stage right here, and it's going to go throughout this granulation phase. Interesting thing with granulation tissue is there's a lot of remodeling that goes on in it during the whole time, where a bunch of it's being made and then some of it's slowly broken down. And so we always keep some degree of phagocytosis there, partially to take care of infection, but partially of it too is to take care of this tissue as it starts to break down and to try to remove it from that area. And the body does it through phagocytosis. So granulation is collagen fibers, and along with those collagen fibers, we get angiogenesis, which is new capillaries are made in that area. Sometimes if we get an overgrowth of granulation tissue from infection or from irritation, we can get something called proud flesh. Proliferation starts after the injury, usually within the first couple of hours. We are already starting into the proliferation phase. And usually in the human literature, they say this lasts up to 24 days. Once again, it's important to note this is if there's no infection. If we get infection, we get this overproduction of this proud flesh, and that can take longer. But in a normal wound, it lasts up to 24 days. Lastly, we get into regeneration, or what they call fibrosis. We also know this as maturation. So in here we get epithelialization, so the granulation tissue is going to be covered with skin, and then the scab is actually going to be removed from the surface. Granulation tissue becomes more fibrous and is what we call scar tissue. In certain tissues, we can get adhesions, like in the thorax or in the abdomen. Epithelialization actually starts in this phase right here after granulation has started, and we start to actually get wound contraction from the granulation tissue. We start to get new epithelial cells growing. And this can last until the wound's covered up, and usually epithelialization is usually somewhere about at least 30 days in the time span, and then can definitely go on to months after that to fully get re-epithelialization, depending on the size of the wound. And then lastly, we have something called remodeling. And so remodeling is actually going down in this granulation tissue and replacing a lot of those collagen fibers and actually making this a much smaller wound. So a lot of the granulation fibers that were in here, when we get into remodeling, are going to actually be taken out, and the body's going to make a much more dense, thick type of collagen fibers to actually hold this together. And you can see it on the surface as a fibrous wound, and then it goes down into the tissues below. And so remodeling is that stage where we're actually replacing the really wide, thick wedge that's making up the scar, and we're going to actually smooth it out. And this starts 3 weeks post-injury, roughly, so about 21 days after the initial injury. And this can definitely last up to 2 years, and sometimes even potentially beyond that. When we look at wound healing, we have classifications. Once again, the book only lists 2 classifications, but there's actually 3 classes you need to know. So first intention is like what I do in surgery. I go in there and we make a wound, or we get a fresh cut in and the wound edges are made, and then we suture them closed to where they're in perfect apposition. And this allows for no granulation tissue to form on the skin, and there's, I wouldn't say no scarring, but there's minimal scarring that's going to be involved. Second intentions, we leave the wound's edges separate. So this would be just letting the body heal itself. And so they're separated from each other. And we get a lot more scar tissue on the surface, and it's much more noticeable. Most of the time, we like to close wounds first intention. If we can get to them right away and they're the size and nature, we can close them. But if we have things like they've been open too long, infection, severe contamination, things like that, we end up leaving the wounds to be second intention. We don't suture them closed. And so we just let them heal by nature. Third intention is a combination of first intention and second intention. So we start these things as a second intention healing. And so we're going to let it try to fill in naturally itself. And later, we will close after removal of granulation tissue. And it'll be similar to what first intention healing is at that point. So we actually go in there and we'll see a bunch of the scar tissue and granulation tissue that comes up from second intention. I'll cut all that out and I'll suture it closed. So we can use these in wounds that are infected, that we have a decent chance that after some second intention treating the infection and stuff, we can actually go in there and close it back again and suture it over like in first intention. Or if we have really large wounds and we have to actually let it scar and contract down, we can actually let it do that and then come back in there at a certain point and cut some of the scar tissue out and then actually pull the skin edges together.